$125.4 million has been approved by the board of the Cypress Health Region for its operational budget for 2012-13. According to a recent presentation made by the Executive Director of Finance, the balanced budget was attained through a number of factors, including vacancy managements, non-salary savings, minor service redesigns, and other areas. Larry Elson indicates the budget process for the coming year begins each October, when department heads sit down at the table with a wish list and then wait for the final provincial dollars allotted when the Saskatchewan budget is handed down each March. And as far as achieving a balanced budget each year, staffing salaries play a big role in how the final numbers play out.
If we ever have a year where we're fully staffed, that's going to be a big issue. Great for the patients and everybody, these positions are needed. But financially speaking, now we got to start looking somewhere else. And you know, when 81% of our budget is on salaries and benefits, you know, getting $1 million out of the other 19%, that's a challenge.
CEO Beth Vachon states this is a transformational year for healthcare, and she and her team didn't want to make any big changes in their program layouts, as health regions across the province continue to face numerous challenges.
You know, again, we talked about that need to flatten the cost curve, and I think one of the things that all health regions and boards are committed to is really looking at where do we find efficiencies in the system. You've heard me say in the past, I'm not sure if we actually need more money and staff. We need to have the ability to be more efficient in how we use them. And so, again, we are committed as a province to flattening that cost curve, trying to contain the escalations that we've seen in the past, and so we knew that's what we were moving into, and we were prepared for that.
Further to the unveiling of the operational budget for the coming year, Elson also stated that the health region concluded the 2012 year with a surplus of $2.98 million to March 31st, a surplus which will be well utilized now in a number of areas.
We've invested some money in support services equipment that we don't actually get money for. People don't think it's glamorous, but we need floor scrubbers and we need dishwashers and we need these types of items. So this last year we spent $300,000. Coming up already we're spending $300,000 this year already in the first 2 months. We're buying some burlage carts with our food carts, and these are the things that we couldn't do 4 years ago. We just pray that something didn't break. You know, we're looking at right now a telemetry system that is on its life cycle. We need to replace that. That could be $400,000. So these are the things with a surplus we have the opportunity to purchase with the knowing that we don't have to scramble to find the money.
The Cypress Health Region employs approximately 1,650 staff members, offering health care services in 20 facilities across southwest Saskatchewan.